Hi, my name is Carmela. I'm a certified myofunctional therapist, and today I'm going to review 3 elementary myofunctional therapy exercises to help you with your tongue thrust. So let's ask ourselves, what is a tongue thrust? We were all born with a tongue thrust. We needed it in order to nurse. But about the time of your toddler years, there's changes in the 7th cranial nerve that allows the back of the tongue to elevate. And for some of us that happens, and for some of us it doesn't. People have different tongue thrusts from mild to moderate to severe. While you are in your orthodontic treatment, we're going to go ahead and help you to consciously be aware of your tongue thrust and give you some elementary physical exercises to help correct your tongue thrust. You may have been given a sheet of exercises 1 through 3, and I'm going to review those with you. So myofunctional therapy is a specialized program designed for the correction of tongue thrust, and those are the 3 that I'm going to review today. The first one is called tongue tip resistance. You will be given a tongue depressor. If you don't have a tongue depressor, you can also use simply the back of a toothbrush. And these exercises are to be done at home, in private, at your convenience. So what you're going to do with this is you're going to stick your tongue, making it as pointy as possible, and you're going to put even pressure on your tongue and the stick. You do not want your tongue to be laying on the bottom lip or the bottom teeth, and I will demonstrate. And you're going to hold it for a count of 5. So stick your tongue out as much as you can. Something like that. What you don't want to happen is to put force on the stick and you end up like this. And what you don't want to happen is to have your tongue laying on the lower lip or the teeth like this. So you're going to do that for a count of 5 and release. And that's exercise number 1. Exercise number 2 is called bite pops. This helps to strengthen the lateral muscles of the tongue. This helps to strengthen the tongue overall. And most importantly, it helps to stretch the lingual frenum. The lingual frenum is underneath your tongue. That is your lingual frenum. So what you're going to do is you're going to suck the tongue up to the palate, to the roof of the mouth, hold as much as you can, open slowly, and pop it with an audible sound, and I will demonstrate. And that is a bite pop. And sometimes when you're doing this exercise, it's very tempting to curl the tongue. You don't want to curl the tongue. Curling the tongue looks like this, where you're just simply touching the tip of the tongue to the palate. You don't want that. You want this. And sometimes you can lose it, so what you can do is just kind of start clicking your tongue and you'll find it again like, okay? So that's number 2. Exercise number 3 is very similar to number 2. It's called open and close. And this again is another strengthening exercise. So you do the bite pop, but instead of making an audible noise, you open and close your bite, and I will demonstrate. And we highly recommend that you do these exercises 3 times a day for 5 minutes each. You do not want to overdo this exercise. If you experience any type of TMJ pressure or problems, you want to discontinue these exercises. Again, these are elementary exercises to help you during your orthodontic treatment, and they are supplementary. Thank you.